The first one here is talking about how early injury evaluation following concussion is associated with improved recovery time in children and adolescents. This is kind of the trend over the past little while, is that all of these different studies looking at concussion recovery, finding that one of the best things you can do is see somebody who knows what they're doing early on in the recovery process. So this is a retrospective study looking at kids under the age of 18 between 2015 and 2020. They looked at a bunch of different things when they first came in: the symptom severity scale, BESS, VOMS, tandem gait, impact, etc. They said clinical evaluation details were the number of days required to seek care, the total number of visits, and the total number of days to recover were recorded. The time to evaluation was obviously the number of days between the injury as well and between the date of the initial evaluation. Recovery time was days between the injury date and the discharge date, so the total time from injury to discharge. And the evaluation time was categorized into 3 groups based on when they presented. If they came in early, that was defined as less than 14 days. Mid was 14 to 28 days, and late evaluation was greater than 28 days. Concussion recovery was defined as return to pre-injury functional status determined by clinical evaluation, the ability to complete the graded exercise testing without symptom exacerbation, and a PCSS score less than 8. So very similar properties to CCMI's program. However, we do a little bit more of a physical exertion test at the end. But here we are, 341 patients. Early evaluation was 26% of patients, 124 people, 36% was in mid, and 38% of people were late. So fairly evenly distributed groups. Mean age was 13 years, 74% were male. Sports was the most common mechanism of injury. Patients came into the clinic on average 38 days post-injury. So obviously this is probably a specialty clinic, and so it takes a while for patients to be able to present there. The average for CCMI, when we look at it, which is interesting, the average is about 4 days. So I think that's a really cool thing. Average concussion recovery time of all patients was 84 days. Average recovery time for early evaluation was 38 days. Mid evaluation was 51 days. And late evaluation was 148 days. So you can tell that right away, the earlier you come in, the better you fare. And this was significant. So they found that 2 significant predictors of prolonged concussion recovery defined as greater than 28 days were evaluation time and initial symptom burden via the PCSS, the post-concussion symptom severity score. Delayed time to evaluation was 1.1 times more likely to prolong recovery. High initial symptom burden was 1.07 times more likely to prolong recovery. Sex, age, number of previous concussions were not found to be significant predictors of prolonged recovery. So the conclusion here is delaying time to evaluation following a concussion can significantly prolong recovery. Now, this is one of the big arguments for allowing allied health or continuing to allow allied health to be part of the concussion care picture. If you look at in Canada, for example, in Ontario, the average wait time to see a family doctor is about 18 days. The average wait time to see a neurologist is about 250 days. So you're talking about having really poor outcomes for patients based on the delayed time to see a professional. And there's a lot of evidence to show that most family practitioners have no idea when it comes to concussion, and most neurologists don't really have much training when it comes to concussion. And so it doesn't necessarily matter in terms of the professional designation of an individual. It matters more so whether or not they are trained and capable and have the experience in managing concussions that matters. And so our goal here is to get as many trained people as we possibly can so that we have easy access, early access for concussion patients, because we know that that significantly improves outcomes. And one of the reasons why is because we can get them into early rehabilitation, which is also a predictor of fast recovery. So there you go.